The combination of 750 mg testosterone, 750 mg Tren Anavar represents one of the most advanced and powerful steroid stacks used in competitive bodybuilding and elite athletic performance. This high-dose triple combination creates an extraordinary anabolic environment capable of producing dramatic changes in muscle mass, strength, and body composition. At this dosage, approximately 7 to 15 times normal physiological levels, testosterone exerts maximum anabolic effects through multiple pathways. Originally developed for veterinary use, Trenbolone modified chemical structure makes it several times more potent than testosterone µ/4 mg. At this dosage, Trenbolone's effects reach near maximum expression. Its nutrient partitioning capabilities are fully activated. Its binding to androgen receptors approaches saturation, and its metabolic impacts become profoundly pronounced. Testosterone provides the essential androgen base. Trenbolone adds extreme anabolic potency and nutrient partitioning, while Anavar contributes to muscle quality and definition. Together, they stimulate muscle growth through complementary mechanisms: testosterone through direct anabolic action and estrogenic pathways, Trenbolone through powerful androgen receptor binding and nutrient repartitioning, and Anavar through selective tissue activity with minimal androgenic effects. Most experienced users opt for Trenbolone acetate at these doses to allow for quicker adjustment if side effects become unmanageable, despite requiring more frequent injections. Both testosterone, and especially Trenbolone, negatively impact cholesterol profiles. HDL often plummets to dangerously low levels, while LDL rises significantly. These changes create a profoundly atherogenic lipid profile that dramatically increases cardiovascular disease risk. Blood pressure frequently elevates due to a combination of water retention, increased red blood cell count, and direct vascular effects. Users typically notice improved muscle definition and reduced subcutaneous water, as the androgenic effects promote a harder, denser look. When combined with calorie restriction, the fat loss can be dramatic while muscle retention remains excellent. Prized combination during contest preparation. The extreme metabolic elevation means users can often diet on more calories than would otherwise be possible while still losing fat. Anavar's contribution to muscle hardness and vascularity becomes particularly noticeable as body fat decreases. Protein intake often needs to exceed 1.5 grams per pound of body weight to support the accelerated protein synthesis. Caloric intake must be carefully managed, while the stack's nutrient partitioning effects are powerful. Excessive calories can still lead to unwanted fat gain. Supplementation with liver support compounds, electrolytes, and cardiovascular health nutrients becomes essential rather than optional. Anavar, while being one of the more lipid-friendly oral steroids, doesn't completely counteract the cardiovascular impact of the other compounds at these doses. While short-term use may be manageable with proper monitoring, repeated cycles at these doses dramatically increase risks of permanent cardiovascular damage, hormonal system disruption, and other organ stress. The stack is absolutely not suitable for recreational use or those without competitive aspirations. Even among professionals, many argue that similar results can be achieved with more moderate approaches carrying significantly less risk. Anavar is typically taken in divided doses to maintain stable blood concentrations. The injection volume required can make administration challenging and may require multiple injection sites. Proper sterile technique is absolutely essential, given the frequency and volume of injections. Comprehensive cardiovascular support, including regular monitoring, cardio exercise, and pharmaceutical interventions, becomes absolutely essential. The hypothalamic pituitary testicular axis shuts down completely, necessitating comprehensive post-cycle therapy if cessation is planned. Recovery of natural function after such aggressive suppression can take many months, even with proper PCT protocols, including HCG, clomiphene, and tamoxifen. Many advanced users at this level opt for blast and cruise approaches rather than traditional cycling. Muscle protein synthesis rates reach near maximum levels, allowing for rapid accumulation of lean tissue even in advanced athletes. Liver enzymes often elevate despite Anavar being one of the milder oral steroids for hepatotoxicity. Kidney stress increases due to elevated blood pressure and increased protein metabolism. Some users report changes in skin texture and increased skin sensitivity. Many users report extreme focus, motivation. In training intensity, the characteristic Trenbolone drive becomes amplified at these doses. However, The same neuroactive effects can lead to increased anxiety, irritability, and in some cases, paranoid thinking or mood instability. Sleep disturbances are common, with many users experiencing insomnia or vivid, disturbing dreams. Anavar's relatively mild psychological impact does little to moderate these effects from the other compounds. Those with any history of mental health issues should avoid this combination entirely. Nitrogen balance becomes strongly positive, creating optimal conditions for muscle repair and growth. The enhanced recovery capacity allows for more frequent, intense training sessions. Muscle fullness and vascularity become extreme as the compounds alter water distribution and increase blood flow to muscles. The stack's nutrient partitioning effects mean that even when eating substantial calories, fat gain remains minimal while muscle growth continues. These properties make the combination popular among competitive bodybuilders in both bulking and cutting phases. The compound's combined effects on red blood cell production significantly enhance oxygen delivery to muscles, improving workout performance and recovery between sets. Metabolic rate elevates substantially, promoting fat loss even during calorie surplus conditions in many users' prized effect during contest preparation. The specific ester used provides stable blood levels when injected twice weekly, though some users prefer more frequent injections to minimize hormonal fluctuations. Users typically experience intense androgenic side effects, including severe acne outbreaks, accelerated male pattern baldness in predisposed individuals, and increased body hair growth. The psychological androgenic effects are equally significant: increased aggression, competitiveness, and in some cases, irritability or mood instability become common at these doses. Anavar contributes minimally to these androgenic effects due to its modified chemical structure. This testosterone dose stimulates massive increases in protein synthesis, enhances nitrogen retention in muscle tissue, significantly boosts red blood cell production. Without proper estrogen control, users risk severe estrogen-related side effects including gynecomastia, excessive water retention, and elevated blood pressure. Most users require careful aromatase inhibition with drugs like anastrozole, with doses typically ranging from 0.5 milligrams every other day to 1 milligram daily, depending on individual response. Anavar's mild antiestrogenic properties provide some additional protection against estrogenic side effects and creates an internal environment where nutrients are preferentially directed toward muscle growth rather than fat storage. The stack is typically reserved for experienced users during contest preparation phases or during specialized bulking cycles where maximum muscle retention during fat loss is required. Testosterone at 750 milligrams per week serves as the hormonal foundation for this stack. Trenbolone at 750 milligrams weekly represents an extremely high dose of one of the most potent anabolic steroids available. Anavar at 50 milligrams daily adds a unique dimension to this stack. As a mild oral steroid derived from dihydrotestosterone, Anavar provides several benefits that complement the two injectable compounds. Its 17-alpha-alkylated structure allows oral bioavailability, while being significantly less hepatotoxic than other oral steroids. At 50 milligrams daily, Anavar enhances muscle hardness and vascularity, provides modest strength gains, and contributes to fat loss, all with relatively low androgenic activity. Its inclusion helps counter some of the water retention from high-dose testosterone, while adding to the stack's overall anabolic potency. The pharmacological interaction between these three compounds creates a uniquely powerful environment for physique transformation. From a physiological perspective, this combination produces several dramatic changes. The androgenic effects of this stack are extraordinarily pronounced, primarily from the testosterone and trenbolone components. Estrogen management becomes critically important with this combination. The 750 milligrams testosterone dose will aromatize to substantial amounts of estradiol, while trenbolone's progestogenic activity can amplify estrogenic effects in breast tissue. The cardiovascular strain from this stack is among its most dangerous aspects. The psychological effects can be both a benefit and significant drawback. From a performance standpoint, the effects are extraordinary. Strength gains often come rapidly and dramatically, with users reporting personal records across all lifts. The stack's impact on body composition is equally impressive. Practical administration of this stack requires careful planning. Most users split the testosterone and trenbolone doses to inject every other day or even daily to maintain stable blood levels. The suppression of natural testosterone production is total and profound with this combination. Other notable side effects include night sweats, increased body temperature, tren cough, and reduced endurance capacity. Nutritional support must be aggressive to match the extreme anabolic environment. Long-term health consequences are a serious consideration with such aggressive dosing.